Okay, so a European challenge for impactful research projects. That's the. I cannot switch the slides. Yes. Up. Now I go too far. No.
There it is. Yes.
There it is. Okay. So the Health Data Hub, and I'm going to focus on the European Health Data Space. So what I just pitched in French, I'm going to repitch it in English, a part of it, don't worry. I'm not going to redo this whole thing, but when I was talking about the fact that we had beautiful database in France, but they lacked a few things, and I was talking about interoperability, problem of governance, and the fact that the data is scattered everywhere. Of course, this is not a French specificity. I mean, we should not, complain and say we are really bad. I mean, this is the main problem of all the countries. Okay. Now, if you look at it at the European level, you have the exact same problems, but at a much higher complexity. It's a much higher level of complexity, much higher. Okay. So of course, the data is scattered everywhere at the European level. It's even worse than in a single country. Of course, there are problems of interoperabilities that are much harder because the coding system is, of course, very different from one country to another. And of course, the governance, though we are all using GDPR, we know that GDPR allows every country to add some layers of legal stuff. And we have a lot in France, but we're not the only one. And these layers are different in all the countries. So though we are all sharing GDPR, all the legal procedure to access the data are totally different in the very different countries. So we had the exact same problems. And of course, if I wanted to enumerate all the problems, I should add, of course, also the fact that there is a lack of citizen empowerment and there is a lack of culture around the health data. So data sharing and everything that comes with it and all these 5 different points is a major challenge at the European level, of course. So it's a major priority for the European Commission and for European health policy. So the objective of this European health data space is to remove obstacles to the smooth functioning of the data economy. And of course, so addressing health data fragmentation and so on. So I'm not going to say all that again. And here are a few, you see a few dates that are key dates for these key milestones for that are supposed to lead to this European health data space. So 2020, there was the Data Governance Act. 2021, I already talked about it. That was the TEDAS joint action, and that started last February. 2021, the pilot of the European health data space. I will be talking about it much more in the next slides. And 2022, we're all expecting, the first draft that was supposed to be published yesterday, and it was postponed by the European Commission, and they announced that they're going to publish it in May. So the first draft for the European health data space legislation, which is going to be a major move for Europe and for all the countries in terms of interoperability. I mean, that's the hope we put in it. We'll see. So, as I said, there are 2 prefigurative instruments for this European health data space: the joint action, so the TEDAS that already started, and the pilot. Okay, the pilot is so there was a call that was published last October by the European Commission. It's a call for a consortium to operate what should be the pilot of the European health data space. The call was closed end of January of 2022. Selection should be announced, or the winning consortium should be announced late April or May for starts in September. I mean, that is what is announced. And it's a 5 million project, so it's a small project with huge goals. So, I mean, everybody has to deal with that. We are all convinced it's extremely important, but the money is not that important. But okay. So we are very, very proud because we are leading a consortium that is a candidate consortium. So we deposited an answer at the late of January, and we are leading a very, very wide consortium. We have with us 8 national platforms with national mandate. So we have Finland, Denmark, Norway, Germany, Belgium, Hungary, Croatia, and France, of course. And we have with us 2 European agencies. We have the EMA and we have ECDC, and we have also some European research infrastructures or international research infrastructures. We have eBrain for mental health, we have Elixir for genomic data, and we have BBMRI for bio data. And we have also some other actors, and I'm not going to name all of them because I'm sure I'm going to forget some, but in France, we have also Orphanet with us, and there are some other, and there is also a Spain institution, IAX, which is a regional institution, and maybe I'm missing 1 or 2 other, and I'm sorry if I do. So what's the goal of the pilot? The goal is twofold. First objective is to build pipelines between these existing infrastructures, so all these national infrastructures and also the European infrastructures, okay? And these pipelines, they had 3 goals, okay? So I'm in the first objective right now. In the first objective, you have 3 goals for the pipelines, okay? So the first goal for these pipelines is to be able to operate and to build a central service that will be able for anybody to run some queries on the metadata of the data sets that are available on the infrastructures. So you'll be able to send questions like, tell me what data sets are available on the whole network of the consortium network, whoever consortium will be selected, in order to understand what are the databases available on this pathology, and I want to know how many people there are in the cohorts of these databases, and I want to know some more characteristics. So you have access to all the metadata that are describing each of the databases that are available on each of these infrastructures. And of course, this is a lot about interoperability. This is interoperability of the metadata. Okay, so that's the first objective of this pipeline. Second objective of this pipeline, to be able to build also a central service for fill up a single access form to ask access to all the data you want to have access in the different countries involved in the consortium. Okay, so instead of just having to fill up Finnish, Danish, or French access form, you'll just fill up one that will be dispatched on all the different countries. So that's also, of course, has to do with interoperability. And this is a major challenge because this is extremely complex. It is at least as complex as more technical interoperability. And then the third goal of these pipelines is to be able to move data. So we're talking about health data, individual health data, from one node to another. Of course, if your project requires to do so, and if you have legal authorization, which is going to be not that easy to get, okay? But at least the pipeline should be able to do so. Okay, so that's the first objective, building this network with all these pipelines, okay? The second objective is to run some use cases with some potentially some very impactful scientific results to prove that it is extremely important to be able to run projects at a European level, mobilizing some European data. Okay. Now, these use cases, so that was the game that was pretty hard to play as a leader of a consortium, which is that we could not say, these are the use cases we suggest and we're going to budgetize that. The Commission wants to have its own word about the selection of the use cases. So we had to give a list of 9 use cases, and out of which a few will be picked up 3, 4, 5, nobody knows. So we will see when they will give the official results. Let me tell you about some of the use cases that we've been working on. Predictive models for cardiovascular pathological events, identification of the level and risk factors for thrombosis in patients with COVID. And we have one use case on the personalized risk assessment and predictive models for colorectal cancer. So again, nobody knows, of course, who will be the selected consortium, and nobody knows what will be the selected use cases. Let me finish with this slide. This is a focus on one of the use cases. This is a use case. In our consortium, we ask all the institutions which are part of the consortium, do you want to propose a use case? So a lot of them did. And of course, the Health Data Hub, we proposed one, and this is the one we proposed. So this is one we know quite well. It's about comparing nationwide health trajectories to evaluate European health data interoperability on the cardiometabolic diseases. Okay, so in this use case, 5 different countries are involved, meaning what? Meaning that we have checked that these countries have the right data to the same kind of data and the right data to address this problem, and that it can be available. It's not too complex to have access to it. Okay. And of course, there will be a huge work about interoperability. That will be one of the major work because we're talking about path trajectories. So you want all the events to be meaning the same thing. So we're talking about semantic trajectory. Okay, so there will be a huge work about the vocabulary. So our database, the SN, we are going to use the SNDS. It is already OMOP, so that's a huge work that has already been done. But the other ones are not OMOP, so we'll have to of course, we won't translate everything to OMOP because that will be too long. So if we operate this use case, we'll have to do some trade-off. So the goal, building health trajectory-based prediction. So basically, you want to do a model for the trajectories, and then you want to use this model to address a problem like trying to forecast some future events, trying to understand what could be the next events of the trajectories, but you can imagine also doing some clustering on the trajectories. Okay, so maybe identifying different type of trajectories to see how they're different. And I let you guess that there are many applications if you are able to do that kind of stuff. Yeah, that's my last slide. So if you have any questions, it would be my delight to answer them.
Thank you very much, Emmanuel.
Thank you.
So we indeed have a few minutes, about 5 minutes to take questions. I have already a few questions from the chat, but we can also take one from the assembly here. Do we have a question here? Yes, we have one here. Then I'll take one from the chat, and we have someone here with a question. Thank you.
So thank you for this very nice presentation and for trying to raise awareness about standardization and interoperability. I think we're all there, so we know the issue. I would like to have maybe more perspective about those standards that you want to push forward. You spoke about OMOP, that's one, and I want to understand as well what exactly you mean by semantics. Like, for instance, do you want to reuse web semantic standards that have been around, for some time as well, that not only define the terms, but also the relation between the terms?
So I'm going to answer partially your question because I'm not the most I'm not the expert on that subject. You will have much better experts talking right after. But yes, when we're talking about interoperability, I just gave one example, which was the coding. But of course, you have. I mean, it is extremely wide. So yes, ideally, you want to go much beyond that. Now. As the Health Data Hub, which one we're pushing, which one we believe in, and so on. I don't think nobody has a definite answer about that. I mean, I don't think nobody can say this is the right one, so on. So we are trying to follow to understand which ones are the most important and follow different roads, and everybody will see what happens next and what will be there will never be just one standard. Nobody believes, I think nobody would agree that there will be just one standard in the future. So it's very hard game trying to guess what will be next. But yes, if you want to stress the fact that it goes much far beyond just semantics saying what a code means, I totally agree with you, yes.
Please make sure to speak in the mic, so thank you. So that everyone remotely can hear.
Also, just that you have so many other databases, and even on the biological research side, that are already using ontologies and semantics and semantic web.
Just to give you an example for the metadata, in the consortium that we built, we decided for the metadata to use some standards that are used in other domains than health, and that are already used at the European level in other domains. So it's very important so that we will be able to connect easily to environment databases and stuff like that. So yes, of course, we have that in mind.
Thank you. So maybe we'll take one or two questions from the chat, and then we can take maybe one more question from the room. We had a question from a representative of a network of 42 patient associations worldwide on cancer and hematology. And the question was about rare diseases or actions related to rare diseases. It says there are a plethora of EU projects to gather data on rare diseases competing between each other, with little said credible about their interoperability issues. When will this crucial work in France be achieved and running? I'm not sure you can answer that, but do you have any intake on this?
No, that's the basic answer. I mean, first, I'm not the specialist of rare disease, very far from that. And of course, this is one of the major issues when we're talking about European health data space. Everybody thinks about rare diseases. Now, how far we are in France in being interoperable, I know that there are some major, we have two major assets in France, I can say that. We have Orphanet, which is a kind of metadata catalog about rare diseases. And we have BNDMR, la Base Nationale des Maladies Rares, which is the national health databases with individual data, so not metadata, about rare diseases. So these are two extremely important French assets, and I think they are not unique, but these are very good examples at the European level, and not a lot of people know that, the different countries. And what I can add maybe, and that's a contribution of the producers of this national database and the Health Data Hub, is that we are going to, in the near future, we are going to operate a linkage between this national rare disease database with the medico-administrative, with the claim database, the French claim database SNDS. And that will be a major step in rare disease at a national level at least.
Thank you, Emmanuel. If you are able to answer this quickly, we'll be able to take one more question from the room. But do you know of any, so it says that there's a good representation of EU members into the consortium of the pilot project that you just mentioned. Do you know if there will be a plan to include other countries, such as Ireland, later on?
From what we understood, but all these, if we're selected, this will be discussed with the Commission. But for now, from what we understood, the consortium is closed. So we're not allowed to include new numbers, at least as official partners of the consortium. So we would not be, if we're selected, we will not be allowed to add a node to this network we plan to build. You have to understand that we have 8 national nodes, 2 European nodes, so that's 10. And with 5 million euros, develop the network between that. That's very, very little money also. So that's a problem. And we already did the budget. So there is no way we could say, yeah, we are going to add one node, even from a practical point of view. But of course, it is very important for us, if we are leading this project, to be in close contact with these countries that have missed being part of the consortium, so that we can discuss with them and tell them how we go forward and at which step and so on. It's very important that they follow us and that we understand also their problems and their specificities.
And will there be a link with Gaia X or other projects?
I mean, we are discussing and we will be discussing with them if we operate the pilot, and that is planned. But to say clearly what will be the link between Gaia X that hasn't totally started, I mean, it doesn't exist, and this pilot for which we are just candidate and that doesn't start, that's hard to say. Yes, we have planned clearly what will be the relationship.
Thank you. Okay, we'll take one more questions and then we'll have to wrap up. I'm sorry. We had one here, and yes, you had one. I'm sorry. If we have a few seconds, we'll try.
Thank you very much. I completely rely with what you said, especially on interoperability and the fact that you cannot rely on one single standard and that each of them has its application. We as Arcane, our job is to build a local data infrastructure, healthcare data warehouses for hospitals, and I know that in France there's an entire strategy for that, for the hub to rely on local architectures. Did you plan the same thing at the European level, and how will those national hubs how will they be fed with data from the data sources from the hospitals?
So I'm not the one to plan what's going to happen at the European level. Okay, let's be clear about that. So did I plan something? No, I didn't plan anything. Okay. Now what is my vision? But you know, that's just my vision. So that's not that much interesting. But okay, I can give it to you. No, I can give you some facts. For instance, one fact which I think is important for the pilot, there was a requirement for the Commission not to do any federated learning, for instance. Okay, that was the first requirement. Second requirement, the only nodes for each country should be national nodes. So there is no way we can say to the Finnish people, you are going to connect to this infrastructure or this hospital in France. It has to go through the hub. So we will move. We are partnerships with some hospitals, and we will be moving the data if we are a node. Now, of course, this will work ultimately. This is just for the pilot, but this will work at the European level only if each country is organized in order to be able to mobilize the data that is needed. But we have to wait to see what the legislation European text is going to say about that, because it's likely that they're going to say how each country should be organized. And I don't have a hint about that. Should be just one coordinator, several ones. You know, there will be a law for that. So.
Okay, and so if I understand clearly, so far there's not a national plan like in France to gather the data towards the platform from the. Well, it's not answered yet.
Let me correct one thing, because I think that's what you are saying. I'm not so sure. The goal of the Health Data Hub is not to take all the data and gather it. Okay, let's be clear about that once for all. This is not at all our goal, and we are very much sponsors of the fact that each hospital should have its own platform. And when you need to operate some research on some data on one hospital, there is absolutely no reason to move the data to the hub, unless you need a lot of GPUs, or unless you need to do a linkage with the SNDS, because these two specificities, a lot of computational power or storage, and this problem of doing linking is not an easy task, and we don't think it's going to be something that should be developed 100 times in France or 200 times.
It's not what I.
So we're not talking about centralizing all the data. Yeah.
I'm really sorry. We'll have to wrap up, but if Emmanuel is around during the break, I'm not completely sure. You'll be able to ask a few questions, but we'll also have our experts on site.
Thank you very much.
Thank you very much, Emmanuel.